Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. And in today's episode, we're going to be talking about safe sleep for infants and children. Sleep is a critical part of an infant and child development. And raising awareness around safe sleep habits is key to reducing infant deaths and preventing child injuries. According to the National Institutes of Health, every year in the U.S., approximately 3,500 infants die from sleep-related causes. Earlier this month, Austin Public Health released a new report revealing that accidental death for infants under 12 months of age here in Austin and Travis County is the leading cause of injury. The report showed that nearly half, 47% of these deaths were in infants under the age of 3 months. More than 2/3, 68%, happened in an adult bed, and 61% of those cases, the infant was sharing a bed with another person. Most of these tragic deaths involve pillows or blankets, items that should never be in a baby's sleep space. Now let's take a moment to talk about infants' sleep needs. During the first 3 months of life, babies need about 14 to 17 hours of sleep each day, with short 1 to 2 hour periods of wakefulness in between. Establishing a consistent sleep schedule helps promote healthy brain development, emotional regulation, and secure attachment, all essential for a baby's long-term well-being. Creating a safe, predictable, and comforting sleep environment gives infants the foundation they need to grow and thrive. We'll be diving deeper into this important topic with our guest expert today, Denise Gleitzman. Denise is the Injury Prevention Program Coordinator for Austin Public Health, focusing on infants' safe sleep. She works closely with organizations across Austin and Travis County to reduce preventable injuries. Denise also serves as the chair of the Austin-Travis County Safe Sleep Coalition and the Impaired Driving Action Team. In her role, Denise analyzes epidemiologic data to guide key programs and make sure the latest injury prevention strategies are being used. She helps ensure that clinicians and professionals in Travis County have access to the most current data on preventable injuries and deaths. Through her work, Denise continues to raise awareness, educate the community, and promote prevention, helping families make safer choices every day. Welcome to the show, Denise.
Thanks for having me.
It's really good to have you here today to talk about this really important topic. So let's start with sleep basics.
Okay.
What temperature should the room be to promote optimal sleep?
So the temperature of the room is typically between 68 Fahrenheit and 72 degrees Fahrenheit. We want babies to be sleeping in a cool but comfortable room. And we also want to think about, because we don't want babies using blankets when they sleep, right? Because that could be a suffocation hazard. We'd like to dress them in one layer more than what we would go to bed in, because we use comforters or blankets, but babies should not be using those. So ideally, you would dress them one layer more than what we go to bed in.
So can you describe what safe sleep looks like versus unsafe sleep?
Yeah. So safe sleep would look like something, and I try to remind people of the ABCs because it's something really easy to remember, but they're going to be alone with nothing in the crib, on their back, and in a crib or pack and play. So A, alone, B, on their back, C, in a crib. And I have some examples here. I wanted to actually start with unsafe sleep and show kind of what that looks like. So in this picture, as you see, the baby is sleeping not alone, with a parent, and then also on their stomach, so not on their back. And then we've got blankets, so that's really a hazard here.
And dad's asleep.
And dad is asleep, right? So yes, and laying down, right? So this would maybe different if dad was sitting up in a chair, was not going to be falling asleep, and baby was sleeping on his chest. That's different, right? And then this is also a good example because this one looks very comfortable and cute, and baby's in that bassinet and all snuggled, but as you see, baby's not on their back, they're on their side, and they have a blanket. So this is also not what we would consider safe sleep. However, safe sleep is where something like this, where we've got a baby on their back, there's no blankets, they're using what we would call a sleep sack instead of blankets. And they seem to be on a firm surface. And another example of safe sleep is this, where they're room sharing, right? So baby is still in their own sleep space. They're in I guess this looks like a pack and play, next to mom in bed, where mom can attend to baby's needs, but is not on the same sleep surface.
Mm-hmm. So thank you for that. Many parents still use loose blankets to keep their babies warm at night, but experts now recommend sleep sacks instead. Why are sleep sacks considered a safer choice, and how can caregivers make the switch effectively?
Okay. Yeah, so we want to give babies blankets, right? But I've also mentioned how we want to dress them in one layer more than what we're going to bed in because we don't actually want to put any blankets in their crib. So a sleep sack is something that is wearable, and it goes over whatever they have on. So it could be a onesie they have on, it could be pajamas that they have on, and then this sleep sack is something that goes over it, usually zips up, and it's just one more layer. I have an example here of what a sleep sack is. This one is kind of big for this baby, but as you see, it's something that they wear instead of something that you put over them. And the reason that's important is because if a blanket is something that could move during their sleep, if baby moves, baby could get their airway blocked, their nose and their mouth blocked by a blanket, but whereas a sleep sack, that's not gonna happen. Even if they move, that's not gonna get up on their face. So that's why it's a better it's a better solution than a blanket.
And it's that extra layer that you're talking about.
Exactly.
Yeah.
And they come in all different, like short sleeves, long sleeves. I mean, there's just many different variations out there.
And different patterns.
Yes, all sorts of cute stuff. Yes, you can definitely. So you don't need the blanket to make it cute. You can find the cute sleep sack.
There you go. Safe sleep is one of the most important ways to protect babies, yet many caregivers aren't sure what a safe sleep setup really looks like. So using a pack and play as an example, what should every parent or caregiver know about creating a safe sleep environment for their baby?
So a safe sleep setup is going to look like using a crib, a bassinet, or a pack and play. So it is going to be something that is approved by the Consumer Safety Protection Commission, and it is going to always be firm and have nothing in it. I don't know how else to go further on.
So no bumper pads,
right.
No pillows, no blankets.
Exactly.
Just a tightly fitting sheet.
A
right?
tightly fitting sheet, yes, on a firm mattress.
Gotcha. So just to go a little bit further into some safe sleep basics and injury prevention, and just if you could, tell us what is the difference between sudden infant death syndrome, or SIDS, and accidental suffocation or strangulation in bed.
Right. So the difference between SIDS and ASSB, or accidental suffocation and strangulation in bed. So SIDS, almost everybody knows that term. It's been around for a very long time. And SIDS actually is where the cause remains unknown after a thorough investigation. So meaning they can't really figure out what the cause of the death is. And we don't really see these type of deaths that much anymore. Even though that's a common term, it's actually not what we're seeing. What we're seeing is what ASSB, accidental suffocation and strangulation in bed, and that cause is known. And that typically occurs 4 ways. The first is through suffocation, so blanket or something gets on baby's airway. The second is what we call overlay, so that's where someone is sleeping with baby in that sleep space and maybe rolls onto baby and blocks their airway. The third is wedging or entrapment, so they could get caught between the wall and a bed or something like that. And the fourth would be strangulation, so maybe clothing gets around their neck or cords from blinds or something like that. So these are all causes that are preventable, and we know what we need to be doing to prevent them. I will say the recommendations for safe sleep does protect against SIDS and accidental suffocation and strangulation in bed, so following the recommendations is what we all want to do, and it will protect babies from both.
Great. To ensure the safety of the baby, where should a baby sleep, and what can be in or on the baby's sleep surface?
So for the safest sleep, we want a baby, again, to be alone in their own sleep surface, like a crib, bassinet, or pack and play, with nothing in it. They need to be placed on their back when you put them to sleep. And again, it needs to be in a crib, a bassinet, or pack and play with a firm mattress.
And how should you lay your baby in their crib?
So you always want to lay the baby in the crib on their back. And that is up to 12 months. Babies will start to roll before the 12 months, and that's okay. If they roll in the middle of the night to another position, that is perfectly okay. You don't need to run in and put them back on their back. But when you put them down to sleep, you always want to be putting them on their back up to 12 months.
Okay. And what is the best way to put a baby to sleep to ensure the baby's safety?
So when putting a baby to sleep, the safest thing is to place them alone in their own sleep surface with nothing in that sleep surface, not on an adult bed, too soft, not in a crib with bumper pads, not in a bassinet with blankets, so alone on their back in a crib, bassinet, or pack and play.
Can babies sleep with bottles in their beds to help them fall asleep?
So we do not recommend that babies go to bed in a crib with a bottle. The natural sugar in many of the liquids can cause tooth decay, and developing primary teeth, especially in these young babies, make them very sensitive to result in serious tooth decay. So any liquid, actually even water, could pool in the mouth and set up conditions that could cause ear infections. So we really don't want babies going to bed with any bottles at all, with water or milk or any juices or anything. If you're wanting to soothe your baby when you're putting them to bed, or wanting them to self-soothe, allow them to use a pacifier or to suck on their hands or their thumbs, but not on a bottle.
Okay. And should adults sleep in the same bed as a baby to help them sleep or stay asleep?
Adults should never sleep in the same bed with a baby. It is really one of the primary causes of accidental suffocation and strangulation in bed. So what we would recommend instead of that is that baby stays in the same room as the parents or the adults or the caregivers. So the pack and play or the bassinet, or if there's enough room, the crib goes in the parent's room and is next to the parent's bed. So the parents are very close to the baby and able to attend to the baby in the middle of the night, but they're not sleeping in the same sleep surface.
What other safety recommendations are there to prevent accidental injury or death in a bed for children?
So we do recommend breastfeeding, as it can have a protective factor on these type of deaths. So any amount of breastfeeding is good, ideally up to 1 year, but any amount is good. Mm-hmm. We also want families to avoid any smoking, alcohol, drugs that could cause someone to be drowsy. And then also, we don't want babies to be overheated, so only dressing them in one layer more than what we would wear to bed. I wanted to come back also to the room sharing. So when we talk about breastfeeding, or even just feeding babies in the middle of the night. We know the youngest babies wake often. That's what they're supposed to do. And having them near you makes it very easy for you to attend to them and feed them in the middle of the night. And we also know that moms will pull babies into bed to feed in the middle of the night. It's understandable, but this is why we really recommend the room sharing, because then when you're done feeding baby in the middle of the night, you can put them right back in their, sleep space, and you don't have to get up and walk across the room or whatever, or accidentally fall asleep with them in your bed with you.
Very, very true. Especially since parents sleep with blankets and there's a chance of wedging or the blanket covering the airway, etc.
Right, or pillows.
Yeah. When looking for safe cribs and beds, should parents be looking for certain safety certifications or requirements? And if so, which ones, and where can they look for more information and vetted product reviews?
Okay. So when looking for a crib or a bassinet, they need to make sure that they are have the safety standards set by the Consumer Product Safety Commission, or the CPSC. And so they did set very strict safety standards starting in 2011 on bassinets and cribs. So if you go to a retailer and you're going to buy a bassinet or crib, they will be following these safety standards. What people need to maybe consider is, if you're going to be buying an older crib, let's say that's older than 2011, you want to make sure it doesn't have the drop-down sides. You want to make sure that they have a snug fitting mattress, and you want to make sure that the slats are no more than 2 3/8 inches apart. But that's really for cribs that had been made prior to 2011. If it's after 2011, they should be following the safety standards already. I did want to add, also, we don't want families using Moses baskets or wicker baskets or doka tots for sleep. So we understand people may use them for short periods of time while mom is awake and is really attending, watching baby, but not for sleep. They should not be sleeping in a doka tot, a wicker basket, or a Moses basket.
Okay.
I just wanted to make sure that we got that in there.
Okay. When can a child start sleeping with a stuffed animal or with a blanket?
So these safe sleep recommendations go to 12 months of age. And that is if the child is developmentally on target. So in general, we say starting at 1 year, you can start putting blankets in there and pillows and toys. But again, if they're developmentally on target. So if you're not sure, I would talk to your pediatrician.
Okay. And when should a child be moved out of a crib?
So the American Academy of Pediatrics recommends transitioning children from a crib into a toddler bed once the crib railing is lower than their chest. So when they're standing up in the crib, and if the railing is below their chest, they've gotten too big for that crib, because they could easily climb out and possibly injure themselves. This usually happens when they're around 2 or 3 years of age. So they can stay in cribs for quite a while.
Good to know. So when the crib railing is below their chest level,
it's time to move them into a toddler bed or a bigger bed or something, yes.
Are there tools that adults can use to monitor a baby's sleep and see how effective are these tools in creating a safer sleep environment?
So the tools that are sold in some stores, such as cardiorespiratory monitors and other devices, are actually not recommended because of the concern that parents will not follow the safe sleep practices because they're going to rely on the tools to alert them if there's an issue. We do know that these items can fail. We know batteries can go out. And as well, these devices are not required to meet the same regulatory requirements as medical devices and have not been proven to reduce sleep-related deaths. So they're actually not recommended.
If parents need to know more about resources that are available on babies' sleep, are there books or trusted resources that you'd recommend? Yeah,
so healthychildren.org is a very good resource, has lots of information. And our austintexas.gov injury prevention page also has a lot of information on safe sleep. It also has the most recent report that you mentioned at the beginning about these type of deaths, and gives a lot of information on the risk factors. And then lastly, AAP.org, their parenting resources page, it's the American Academy of Pediatrics, has some book recommendations for families.
Where can parents look to keep up to date on the latest safety standards and baby product reviews to ensure that they have the most relevant information and data?
So the AAP.gov, again, is a really great website from the American Academy of Pediatrics. They're going to always have the most recent safe sleep recommendations on there. But as far as looking at products, you would probably want to go to CPSC.gov, which is the Consumer Product Safety Commission's website, and CPSC.gov.
Okay, good.
Yes.
Thanks. Good. Thank you. That's all the time we have for today's episode of Health Talk. I want to repeat those resources for parents out there. You can go to austintexas.org and the APH's injury prevention page, to healthychildren.org, or to the American Academy of Pediatrics website, aap.org, and look at their parenting resources section. And then for products and information on products for babies, you can go to cpsc.gov. Again, a big thank you to you, Denise, for being with us and sharing your expertise with us today. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.